Today we'll be talking about a very interesting MRI. Now, this is MRI of the brain with stroke protocol. Now, why we call this as a stroke protocol? Because any patient presenting with sudden onset of neural focal or deficit, neurodeficit, we always go for stroke protocol. So, what is stroke? It is focal onset of a new onset of a focal neurological deficit that is attributable to a vascular cause. That is what we call it as stroke. So whenever any patient presenting in emergency or casualty is presenting with sudden onset of neurological loss, we suspect stroke, and we always go for MRI, CT scan or MRI of the brain. Now this is CT scan of the this is MRI of the brain with stroke protocol. When we call it as stroke protocol, it consists of three things basically, which are unique to this is DWI imaging, this is ADC imaging, and this is GRE imaging. Now, why these imaging are there? So whenever we are talking about stroke, it will be either ischemic stroke or bleeding or hemorrhagic stroke. So when we want to see an ischemic stroke, these two, DWI and ADC, will confirm that whether there is an infarct or not. And if we are suspecting hemorrhagic stroke, now this GRE will show us very crystal clear bleed. So that is the reason why this is very beautiful stroke protocol, which consists of DWI, that is diffusion weighted imaging, and ADC, that is afferent diffusion coefficient. Now, what exactly we can see is in this DWI and ADC, these are more of a complementary to each other. So whenever there is an acute stroke means stroke which has a duration of around 7 days. Okay, so whenever we are talking about an acute stroke, 7 days, this DWI imaging will show us diffusion weighted restriction. So what do you mean by restriction is we'll see any lesion more of a hyper intense or more of a white, we can in simply shortly can consider as a white lesion or white structure on this TWI. What we read it as is we say that there is a diffusion weighted restriction areas or discrete lesion is seen over a particular area. So we always know that as this is stroke, it has to follow some particular arterial path. Then only we can label it as stroke. So in this case, what we can see, it is very crystal clear that the posterior part or the lateral part of this brain is involved. So we can compare here, there is no lesion, here there is no lesion, here there is no lesion, there is no diffusion weighted restriction because this is DWI. But on this left side, we can very crystal clearly say hyper intense, not actually hyper intense, but a whitish lesion, what we can call it a hyperintension lesion. And most suitably, it is called a diffusion restricted lesion on this left posterior aspect. So whenever it is posterior aspect of the brain, it is usually the posterior circulation stroke, posterior cerebral artery stroke or vertebral artery thrombosis. So whenever it is posterior circulation, we must know that posterior circulation usually involves brainstem, thalamus. These are very commonly involved structures in posterior circulation stroke, and occipital cortex, parietal cortex. So these are the structures which are involved in posterior circulation stroke. And whenever we are talking about middle circulation stroke or the stroke which is supplied, the brain part which is supplied by middle cerebral artery, then we are talking about the temporal area, we are talking about the parietal area, we are talking about this subcortical structure. So in this case, it is more of a at the boundary of this middle cerebral artery and posterior cerebral artery. And you can see that in this case, the thalamus is very much spared, the brainstem structures are not involved at all. So you can see that these are the two thalamus. This is thalamus. This thalamus is completely spared. The brainstem structure, like this is pons, midbrain. These are completely spared. So only posterior lateral portion of this parietal area is involved, and some part of occipital area is involved. So this is more of a watershed area infarct. Watershed area means where this middle cerebral artery and this posterior cerebral artery, they give blood supply. So this area is covered by a middle cerebral artery, and this area is covered by a posterior cerebral artery. So this is more of an watershed area infarct, and as it is not involving other structures of posterior circulation, so it is more of a watershed area, but mainly involved by the middle cerebral artery. Now, to call it as acute stroke, we must have diffusion weighted restriction in this DWI, which we are very clearly able to see. And to call it as an acute stroke of less than around 7 days duration, you must have exactly opposite, a black lesion or a very low intensity lesion or low intense lesion exactly to this area. So this and this can be matched. This can be matched. So here it is white, here it is black. So we can simply label that this is an acute stroke. Whereas after around 7 to 10 days, these things exactly reverse. After 7 to 10 days of an acute infarct, this will be blackish and this will be whitish. So here it is showing diffusion weighted restriction on DWI, and exactly opposite to that is a blackish lesion at the same spot on ADC. So this is an acute infarct of less than 7 days duration. And on GRE, if this has bleed anywhere, this will be a very much dark black in color, just like this or just like this. So in this is actually artifact, this is an artifact, and this should be matched with patient's clinical symptoms, whether hemiparesis or vision loss or any other particular neurological loss, and that area should be matched up with the lesion. So in GRE, it is clear you are not able to see any dark black spot in this territory. So there is no hemorrhage at all. So this is MRI brain with stroke protocol, with DWI, with ADC, and with GRE. This is basically a FLAIR imaging. This is T2 FLAIR imaging. FLAIR, the long form FLAIR is fluid attenuated inversion recovery image. What we exactly do is to see the periventricular lesion, because we know that this is T2 image, because I have made a separate video of T1 versus T2. The CSF in the ventricle, these are black. Normally in T2 weighted image like this is T2 weighted image, this is ventricle, and this is white. So CSF looks white on T2 weighted image, but if you want to see whitish lesion which are around the ventricles, suppose here is some white lesion, then it will be difficult to differentiate between this white and this white. So in this case, what we do, we simply keep everything white except the CSF. So we change or we invert this whitishness of this CSF, we make it black. So what we do is we attenuate the fluid. So we attenuate it and we make white to black. So now it is black, and we invert that and we recover that image, and that image is called FLAIR. So this is a FLAIR imaging. This is a T2 weighted image where actually CSF should be white, but we have kept everything else as T2 only except CSF, which was white. So now the CSF is black. So this is T2 FLAIR imaging. And this FLAIR imaging, the best feature of this T2 FLAIR imaging is it will show us all the new as well as old lesions. So this cannot actually tell us whether a particular lesion is old or new, but it will tell us all the problems, all the lesion. You can very nicely make out that it is showing the lesion here. So it will not tell us whether it is new or old, but it will 100% tell us the problem. So if you want to identify a new stroke of less than 7 days duration, you can take help of DWR plus ADC. If you want to see bleed, go with GRE. That's all for today. Thank you.